So you start to see changes in your breast. Gets fuller, gets more tender, nipples start to get darker. Then you might just suspect that, okay, I'm pregnant. What's up, beautiful people? Welcome to another exciting episode of Labor Room with your pregnancy partner, Dr. O. You already know. And today, by popular demand, we're going to be talking about something very, very interesting. Right? A lot of you have been asking, telling me, sending me DMs and stuff to talk about changes to expect in the first trimester of pregnancy. Yeah, I know for you veteran moms, you're like, what's the big deal? Yeah, that's for you guys. But for the new moms, people that have never been pregnant before, they're anxious, they want to know what to expect so they can be better prepared, right? It's better to know ahead, right? So today we're going to be discussing first trimester changes in pregnancy. Stick around. When you get pregnant, that first trimester pregnancy is normally said to be like the time where you are pregnant, but nobody knows you are pregnant. So like in other trimesters of pregnancy, like at least your bump is showing, everybody's starting to see that you're pregnant, you know. But in first trimester, literally no one knows except all those senior mommies that just in fact the day one, the day that the baby implanted into the womb, the mommies can already see you're pregnant. They just look at you and like, you're pregnant, you can't do pregnancy test. But if you're not part of the senior mommies, then first trimester pregnancy is literally invisible. And you know the irony is that in first trimester, that's when you need all the sympathy, empathy you can get. You know when you're in second trimester, when you're having fun. Second trimester pregnancy, that one we're going to talk about it a little later. But that one, like you're living your best life. Like sometimes you even forget you're pregnant in your second trimester, right? So that's when people will not be pitying I'm saying, sorry, do you want to sit down? Do you want this? Do you want that? Oh, she's a pregnant woman. Oh, let her jump the queue. You go to bank and be so that they will like jump the queue. You enter somewhere and there's no chair for everybody. Maybe everyone is waiting for an appointment or something, and you start doing, you just get up for it. Let the pregnant woman sit down. But in first trimester, when you need it the most, nobody pities you because no one knows you're pregnant. So you are there suffering and smiling, literally. Okay, so let's start with the first symptom I'm going to talk about, which is tender or swollen breasts. The point where most women realize that they're pregnant is when they miss their period. So when you start looking for your period, where's my period? Where did I keep it? And you do pregnancy test, and you now see two lines on that pregnancy testing strip, or for the digital one, it's to write pregnant. That's when you know that okay, you're finally taking it. So after or even before taking pregnancy test, there are some signs that you might notice. Okay, I have a video where I talk about early pregnancy symptoms, similar to what I'm going to talk about today. One of the first symptoms I want to talk about is swollen and tender breasts. So when you get pregnant, sometimes even before you take a pregnancy test, right? That time when you are waiting patiently to see your period, or for those that are trying to conceive and not even wanting to see your period, you're like, please don't even come this month, I don't want to see you. You just start noticing that there's some changes in your breast. Maybe if you wear bra, the bra is too tight, the breast will be paining you, or if someone mistakenly hits you, it will be more painful than it should be. Then you start noticing that your breasts are getting a little bigger than usual. They're looking a little more plump, a little fuller than usual, right? That's one of the early changes that happens in your body when you first of all get pregnant, and it usually starts in the first trimester. So you start to see changes in your breast, gets fuller, gets more tender, nipples start to get darker. Then you might just suspect that okay, I'm pregnant. In this case, you've done a pregnancy test, I know you're pregnant, so you're like, okay, this is one of the changes that Dr. O said I was going to experience. So I'm experiencing it. So I'm truly pregnant. It wasn't a fake result I got. Then another symptom that you notice in early pregnancy, this one is common, universal sign of pregnancy in African movies: nausea and or vomiting. So you see that morning sickness of a thing, oh my gosh, most women experience it in the first trimester. Second trimester, for most women it has subsided and you're not really experiencing it, although for some they still experience it in second trimester, but that's only very few women. Most women by second trimester they're already chilling with the big boys. For that first trimester, like I said earlier, you are suffering and smiling. Any small thing will make you feel like throwing up. You eat food, you want to. And I was pregnant with the second child. There was a day that I could not keep anything, like not water, not pee. I couldn't keep anything down. Anything that comes into my mouth, I was throwing up. The whole day I was throwing up and I couldn't eat anything. Like it was that bad. So sometimes the morning sickness can be so bad. But Like I always say, I got you covered. So I have a video where I talked about useful ways to deal with morning sickness. It's also going to be linked at the end of the screen or somewhere in the description section. And if like some miracle is not there, just look through my videos and you'll find it. 8 useful ways to deal with morning sickness. Make sure you watch it if you are pregnant or planning to get pregnant. Okay, so like I was saying, nausea, vomiting, most women experience it in the first trimester and it is crazy. You go in fact, a lot of women even shy away from going out because of that. And those that have to go to work, take the grace of God not to go and throw up in your workplace, because that first trimester nobody knows you are pregnant. So if you want to show yourself, expose your pregnancy, just start throwing up in the office. The whole world will know that yes, this one is definitely pregnant. Now the next symptom I want to talk about when you are pregnant. This one is very common amongst pregnant women and it usually stays with you all the way, right, till the end of the pregnancy. And that's frequent urination. You see, when you get pregnant in the first trimester, one of the changes you notice is that you're just going to pee frequently. Any small thing, you get up, you go and pee. You get up, you go and pee. Even if you're not drinking more water than you usually drink, you just begin to pee. You go to one place like this. First thing you are asking is, please, where's the bathroom? I want to pee. Everybody already knows you that toilet is your best friend. That is because when you get pregnant, okay, there is more fluid. Your body tends to absorb and retain more fluid. So because the blood volume is increasing, your kidney is processing more fluids, right? And of course, the kidney is in charge of removing excess fluid and all that from the body, right? So it ends up in your bladder and then you get the urge to go to the toilet to pee, basically. So that's how it works, right? That's what's happening right here. You are getting the urge to go to the toilet to pee and it's more than usual. You're just going frequently. Next symptom I want to talk about in pregnancy, early pregnancy, first trimester pregnancy. You know that when you watch African movies, they actually teach us a lot too. You see pregnant people. Anytime a mommy wants to know if her daughter is pregnant, minus the nausea and vomiting that we already know, there is not the one that should be sleeping all the time. Any small thing should just be sleeping. Any small thing should. And the mom will now be like, why are you sleeping like this? Why are you sleeping too much? I'm going to take you to the hospital. I'm going to see the doctor. You cannot be sleeping like this in my house, because early changes or one of the first trimester signs of pregnancy is fatigue. And this is caused by a hormone called progesterone. That progesterone hormone, it just makes you so tired. You just sit down. Your body just feel like a heavy log of wood. Then you just sit down. You don't even know when you go to sleep. You can talk to someone and you just feel like it. Okay, I'm just joking, it's not that bad. But really, you are tired all the time. But the good news is, after your first trimester, that feeling goes away. You're not as tired. In fact, that second trimester, you're more bubbly, you're more active, you're more lively. But that first trimester, no go area. You're just tired throughout. Okay, so that's one of the changes to expect in first trimester. So prepare yourself for, if you're already pregnant, don't go and plan any fun activities for that first trimester, because nausea and vomiting will not allow you. Fatigue will not allow you, and then when you go out, you'll not even have peace because you'll be looking for toilet all the time. Another symptom that you should expect in your first trimester. This one, most pregnant women, this is the symptom they like the most, especially the foodies amongst pregnant women. That one is food craving. Any small thing. I want to eat pepper soup, but not ordinary pepper soup, the pepper soup that Mama Yabasira makes. That's the particular one I want to eat. You now be craving ice cream. You be craving burger, you craving hot dogs, craving suya, craving anything. You just wake up in the middle of the night. Oh, I want to eat this, I want to eat that. And women usually use this to exploit their husbands. Honey, can you go and get me shawarma? But it's just 12 a.m. You can't be going out at this time. No, I need shawarma now. Baby needs to eat now. You guys should fear God. The baby needs to eat what? If the baby asks for food, stop lying on the baby. Anyway, food cravings is something you should expect in your first trimester. Funny enough, not every woman experiences this, but most women say that they experience food cravings in their first trimester. And as much as you experience food cravings, then you also experience food aversion. So that means sometimes things that you used to like eating, all of a sudden, you can't even stand to see it. You can't stand to taste it. You can't stand it, right? Like when I was pregnant, I used to love Coke, right? But when I threw Coke up 1 million times, even the smell of it, the sight of Coke became my enemy, right? So I started to hate Coke. So those kind of things, your best drink might become your worst drink in first trimester because you throw it up and just hormonal changes, right? So yeah, look out for that. It just might happen to you. Not everyone experiences it, but a lot of people do experience it. So you might want to look out for that in your first trimester and don't be surprised if it happens to you. The last two symptoms I'm going to be talking about in first trimester are Not very pleasant symptoms, but yeah, you can expect for it to happen because most pregnant women experience it in their first trimester. One of them is heartburn. Oh my gosh. You know, when you get pregnant, your body releases a series of hormones, and progesterone again, that progesterone is one of them. And what it does is it relaxes the muscles of your body, including the muscles that you use for swallowing. So basically, the valve that is between your tummy and your esophagus. So your tummy is somewhere here, your stomach. And then your esophagus is that long tube from your mouth all the way to your stomach, right? So there's a valve that keeps the opening between the stomach and the esophagus closed, right? So that acid cannot flow back into the esophagus. But when you get pregnant, because of progesterone hormone, that valve relaxes. So it's not closing properly. So acid is now able to flow back from your stomach into your throat. And this causes what we call heartburn. So your chest will just be like purplish kind of burning sensation in your chest, and it can be really unpleasant. But if you experience this symptom, not to worry. There are drugs that you can take. Just speak with your doctor, right? And your doctor will prescribe something for you that can help the heartburn. One of the ways you can deal with this is immediately after eating, do not lie flat. Wait about 2 hours, 3 hours before you go to bed or before you lie flat, so that the food can digest and then you won't have the acid reflux. Another thing is, don't eat large quantities of food, right? Eat small portions, little portions, that helps. So last symptom I want to talk about, it also has to do with your digestive system. This is constipation. In your first trimester of pregnancy, you can expect to be constipated. Like I said, not everyone experiences this symptom, but most women do. Constipation. You see again, this is because of hormones, progesterone, just because it slows the passage of food through your digestive system. So food tends to take longer to digest and all that. So you notice that you start getting constipated. Your poo is harder than usual. You start straining to poo. It can be really, really, really annoying, right? So to relieve this, you want to take a lot of foods that are high in fiber, take a lot of fruits, drink a lot of water, right? This really, really helps. And also increasing your physical activity also helps to relieve this constipation in first trimester pregnancy. So these are the few symptoms that I thought I should let you know. I should give you a heads up so you won't be shocked like, okay, what's going on with me? That, hey, is this how this pregnancy? Trust me, there are many more first trimester pregnancy symptoms. I just thought to talk about this few because these are the most common ones people experience. Okay, there was one more I forgot to mention. Excess salivation. Your body will just start producing saliva anyhow. That's why you see pregnant women in their first trimester, or even afterwards, they just be spitting everywhere because excess saliva is being produced in your mouth, right? So that can be another unpleasant first trimester symptom that most pregnant women don't really like. These are all the symptoms of first trimester pregnancy that you can expect to experience. Let me know, veteran moms, which of these symptoms did you experience? New moms, let me know which of these symptoms are you looking forward to, if any, or are you not looking forward to experiencing, right? Let's know in the comment section down below. And don't forget to like this video if you enjoyed it so far. Don't forget to share it with any pregnant woman around you or someone you think might need to see this, anyone that is planning to get pregnant, right? And if you haven't subscribed, please click the red subscribe button somewhere down below. Okay, click the subscribe button. Okay, God beg you. Thank you so much for watching. Always remember, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.